Okay, so if you've ever dealt with serious back pain, you know there are certain words, certain phrases that just send a shiver down your spine, right? And maybe the biggest one of all is herniated disc.
And let's be honest, for most of us, when a doctor says those words, our minds just jump to one place. Pain, yeah. Physical therapy, sure. But the big one? Surgery. It can feel like you've just been handed a one-way ticket straight to the operating room.
But what if I told you that's not always the end of the story? Not even close. What if, in a whole lot of cases, the story has this incredibly surprising twist where your own body is the hero? Okay, this is fascinating. Let's get into it.
So, we're about to pull back the curtain on this amazing natural healing process. It's something that's been well documented in medical science for a long time, but for some reason, it's not really common knowledge. Think of it as your body's hidden superpower for dealing with one of its most common problems.
All right, the fancy science term for this is spontaneous resorption. I know it sounds a little intimidating, but the idea behind it is actually beautiful and simple. It means that the part of the disc that's herniated can just disappear. It goes away on its own. Your body literally cleans up the mess. No scalpel required.
And look, this isn't some pie in the sky theory. Just check out these MRI scans. On the top left, in image A, you can see a pretty gnarly disc herniation, right? Now look down at image D on the bottom. This is the exact same person just 4 weeks later with no surgery. That herniation, it shrunk dramatically. This is spontaneous resorption caught on camera. It's amazing.
Okay, so that leads to the obvious question. When does this happen? Is it just random? Can we actually predict it? And the answer is, yeah, we can. It turns out the MRI scan itself is full of clues. It's kind of like a detective story, and we're looking for the signs that tell us if a disc is going to heal itself. And the big takeaway from the research, like the review we're looking at today, is that not all herniations are created equal. The specific type of herniation, its shape, its size, it all matters a lot. So let's get into the first clue, and I gotta tell you, this one is completely counterintuitive. I mean, you'd think a tiny little bulge would be way easier for the body to handle than a huge one, right? Well, nope. It's the opposite. The science shows again and again that the bigger, the messier, the more dramatic a herniation looks on that scan, the more likely it is to heal on its own. The bigger the problem, the more powerful the body's response. And this next part explains why that's true. So let's use the classic analogy. Think of your disc like a jelly donut. With a small herniation, the jelly just kind of bulges out a bit but stays contained. But with those big ones, like you see here in type 2 and 3, the jelly actually squirts out of the donut. And once that inner material is exposed to your bloodstream, it's like a giant red flashing alarm goes off for your immune system. And the numbers here are just wow. A study from 2017 found that the most severe type, where a piece totally breaks off, had a 96% chance of resorbing. 96%. Extrusions, 70%, but a simple bulge, only 13%. So the takeaway is incredible. Sometimes what looks like a worse MRI is actually fantastic news for natural healing. All right, so that's clue number 1. Bigger can be better. Now for clue number 2, another thing that can show up on the scan. On some MRIs, radiologists will see what they call a bullseye sign. So what do you think that means? Good? Bad? Well, you might think a bullseye made of inflammation sounds pretty bad, right? But it is the exact opposite. That bright ring you're seeing in types A and B, that's the money shot. It's visible proof that your body has already spotted the problem and sent in the troops. The cleanup crew is already on site. It's a fantastic sign that healing has already begun. Okay, so we've found the clues. Now let's meet the crew. What is actually going on inside your body at the cellular level? Let's take a look at how your body's amazing internal cleanup crew actually does its job. It's actually a really elegant little process, just 4 steps. Step 1, a piece of that disc material gets outside of its normal home. Step 2, your immune system spots this intruder and sounds the alarm, which kicks off inflammation. Step 3, specialized cleanup cells, mostly these guys called macrophages, get the call and rush to the scene. And finally, step 4, these macrophages literally start eating and dissolving the herniated tissue. It's incredible. Now, this diagram looks super complicated, I know. Don't worry about all the acronyms and arrows. All this is showing is the science behind what we just talked about. The key thing to see is right there in the middle. The ruptured disc starts that inflammation, and the information is what calls in our cleanup crew, the macrophages.
They release stuff to dissolve the disc fragment and even help grow new blood vessels to haul away the debris. So here's the absolute most important thing to get. That initial inflammation, it is not the enemy. It's the engine driving this whole healing machine.
Okay, so why do you need to know all this? What's the point? It's simple. This knowledge empowers you. It totally changes the game. It takes you from being just a passive patient to being an active, informed partner in your own healthcare. Because now you can walk into your doctor's office and have a totally different conversation. You can ask really smart questions like, hey, based on my MRI, what type of herniation do I have? Or do you see any signs like that rim enhancement that might suggest my body could heal this on its own? It helps you understand why watchful waiting isn't just doing nothing. It's a powerful strategy. You can actually ask if you're a good candidate for trying conservative treatment first. And look, this isn't just me saying this. The authors of the study wrap it up perfectly. They basically say that knowing about these signs helps doctors pinpoint the people who have a really high chance of getting better on their own. And that lets them choose non-surgical treatment with more confidence. That's a huge win for patients and doctors alike.
So this all leads to a really fascinating, kind of mind-bending final question. For decades, the standard approach to back pain has been to just crush inflammation with powerful drugs. But if we now know that inflammation is the very thing that kicks off this amazing natural healing process, should we be so quick to shut it down? Could the future of back care actually be about inflammation-preserving treatments? Ways to manage the pain without turning off the body's incredible built-in healing system? It's definitely something to think about.